Hello, this is Wendy Briggs bringing you Monday's Missing Piece. Now, for those of you that are fairly new to this format, Monday's Missing Piece is a 3 to 5 minute training resource for your practice. These will be produced by members of the Team Training Institute, great mentors and coaches that we have on our team. And you should look forward to receiving one of these every Monday so that you can have a resource to add into your morning huddles or team meetings at some point during your week. Today's topic is going to be on CAMBRA, Caries Management by Risk Assessment. Now, this is something that hopefully many of you are utilizing in the context of your hygiene appointment. We've created some resources to help make that happen. Some exciting new changes for 2014 is that there are now codes from the ADA and CDT that can be submitted to insurance when you're performing CAMBRA in your practice with your patients. So are you using these codes yet? And have you embraced some of the resources that we've made available for the risk assessment conversation with many of your patients? You know, one of the things that I recognize is that many patients consistently are frustrated by having cavities consistently. It seems to them that no matter what they do, they always have a problem. So that's why we created the Proactive Prevention brochure for you to utilize with risk assessment. And our goal is to have you accomplish this or have this conversation with every patient in hygiene. One thing we found is when we do this, it builds value for what we do. In the patient's mind, it becomes more than just a cleaning. So the other thing for you to know is the risk assessment survey that's in this brochure has been adapted from the ADA's own survey. So widely accepted resource to ascertain what level of risk this patient may have, your patients may have. Another thing that I've noticed is that when we are having this risk assessment conversation, we are driving interest in preventive services. So this is a comprehensive example of what that brochure looks like. And here's the risk assessment survey on the inside. And we quote here the American Dental Association saying, "A patient's risk for developing caries is a moving target." We also quote the National Institute of Health that says considerable benefit could be achieved if people at high risk levels could be identified before cavities develop. So once you figure out with this patient what their risk status is, then it enables you to more effectively discuss or talk through the proactive solutions that are also included on the back side of this brochure. If you are at high risk for decay, here are some steps we recommend that can help to minimize your risk. So again, we've created this risk assessment survey to help you do a more effective job helping patients understand what they can do differently to minimize future problems with their teeth. So if you don't have a copy of this yet, a simple way for you to access this resource is to log in to the Team Training Institute member site. You would want to look under Wendy's Library, and there's a category there that says Mentioned at Events, and that's most likely where you'll find the most current version of this risk assessment brochure. Now, I want to go ahead and take a moment to discuss these new ADA CDT codes for 2014. So if you are doing the risk assessment survey and you have that caries conversation with them, the risk assessment conversation, and they are determined to be of low risk, then your code would be D0601. If they are at moderate risk, you would use the code D0602. And if they are high risk, you would use D0603. Now, interestingly enough, I just read an article that the ADA has added us another risk status, which is extreme risk. And this is to be assigned to anyone who's struggling with xerostomia or is on any prescription medications that are causing a struggle with dry mouth. So just so you know, and the patient knows, that if they have high risk for other reasons and they're taking prescription medications that cause xerostomia or dry mouth, they are now to be considered high or extreme risk for decay. So there are those new codes for you. We would encourage you to revisit your protocol for having a risk assessment conversation. Embrace and utilize that risk assessment brochure as you can now submit that to insurance. Have a great week, and thanks for listening to today's Missing Piece.